So, Dr. Wasan, do you have any examples of talking with a patient, listening to a patient about treatment expectations? Maybe an example of when they have really low expectations, or maybe really high, maybe too high expectations.
Yes. If you start with the response where they have very low expectations and they don't expect to improve, that's happened several times where I've seen that on our required printout. And I'll say to the patient when I'm discussing the assessment plan with them, "Oh, I noticed that you don't think that you're going to get any better." And I let them talk about why they think that is. And then generally I reply to them and say, "Well, we're doing something different and new that you haven't had before. And on the one hand, we can't make all your pain go away, but we do think that you can get significantly better in the next few months. So it's important that you keep an open mind and try to be positive because those are the things that you can do on your own to help yourself. And you'll find that you'll probably be doing better if you have that mindset over the next several months."
So, how did that come out? What was the response of the patient?
Well, the response of patients were good in the sense that they didn't expect that a doctor would bring that up.
Mm.
And they were able to take a step back and say, "Well, yes, nothing really helped me before. That's why I said I'll never get any better." And so it got them in that little bit of a few seconds to reframe a little bit, that, oh, well, maybe I should try to look at things a little bit differently. And maybe this will be a little bit different.
Mm-hmm.
And so at least I got them to reconsider that, the way that they're thinking about their pain and their life is also something for them to work on.
That sounds like a very important conversation to have.
Yes,
Yeah.
you can understand, just our own mental framework, going into anything. And we go into school and we think it's going to be terrible and it's never going to be enjoyable. Of course, it's miserable. But if you go into any experience with a bit of an open attitude, an open mind, and a positive attitude, you're likely to get a lot out of it. And the same is true with your pain care. And in that short little 10 to 30-second interaction, I think you can really make some progress on some of the psychological issues.
And I think you can also build trust even by just asking the question.
Yes, good point.
Mm-hmm.
Patients really seem to like when you ask about these more interpersonal, psychological type of things. It shows that you care. It shows that you do indeed want to take complete care of them as a whole person with pain rather than a patient with pain. And that really seems to spark a few positive things, just even in that brief time you might spend with them.